Well, good afternoon, and thanks very much for giving me the opportunity to talk. So, as Bridget said, my expertise or experience, I'm a biological scientist, have worked in pharma, biotech, set up a number of companies. And when given an opportunity like this, it's very tempting just to tell you all the really clever things that happened and the things we did really well. However, looking back on if I were 10, 20 years ago, some of the experiences I've had where things haven't gone well, actually I learn much more from. And so today I'm going to give you a bit of, I guess, my experience of the good and the bad. And it comes down to customer. Customer, I mean somebody who might buy your product or buy your service, or somebody who might partner with you or might collaborate with you. So that's a really broad term for customer, but really it's somebody else you're going to interact with. And in order to do that well and do it properly, I think you really need to understand where they're coming from. And that's what comes to who is your customer and what is their problem. Nobody does anything without it being important to them. So to really understand what their problem is, and sometimes, unfortunately, they may not actually know or be able to articulate what that problem is. So that's what I mean by sometimes what they want, what they think they want, isn't what they really need. So obviously, for any idea to have any form of success outside your own world, you need somebody who wants or is interested in that. And in order for them to want that, they have to have some sort of problem or pain. Are they aware of this pain? Do they have the freedom to do something about it? Do they have the ability to interact with you? Do they have the money to help you do that? And the last one is, who is your customer? Can you actually go out and find them? So there's this whole thing of want versus reality. So today I'd like to give you a few stories about experiences I've had where things seem very obvious but didn't go very well. And then a little bit about some techniques that I was taught or that I've used that helped me progress certain businesses. And then really a little story about how that worked very well. And I was involved in a company called BioCity. So I was a part of the BioCity group. They were my major shareholder. And they're very passionate about trying to create entrepreneurship and start young businesses, people with great ideas. So they have many courses that they run, and I'll admit a lot of them were really box-ticking exercises for me. You go and someone in front of you tells you some great stories and a few good comments, but what does it actually mean for me? At the end of today, I'd like to think that there may be one or two small things that I've learned that might be useful for some of you. I think one of the points, Steve Jobs, but really what he discovered is that you know what you can do. Being able to articulate that is difficult. Being able to understand what people actually want from you as well is equally difficult or more difficult than you may think. And as part of this, he discovered that if he went and asked lots of people in a group what it was they wanted, he'd really have no idea because they couldn't articulate themselves what they really needed to solve their problem. And so your job is to get down to that, understand what their problem is. So just a little bit about who I am and why I'm here. See, the Scottish Biomedical logo is pretty rubbish, but then that company doesn't exist anymore, so it was hard to get. So my background, I'm a biochemist, I PhD, postdoc, and then decided that having done some work in pharma and biotech, the big pharma and biotech were not for me. Rules and restrictions weren't really my thing. So I was asked to go and set up a small early stage drug discovery company to provide biology and chemistry drug discovery to biotech throughout the world called Scottish Biomedical. And we went from 2 people to 50 when I was then approached by a Japanese pharma to go and move to Tokyo. and run their respiratory disease franchise. And that was everything from R&D through to marketing and trying to understand what the future needs for respiratory disease would be. Part of that was trying to bring innovation into that pharma company. And what I discovered was just finding an interesting academic idea, bringing it into the pharma. My researchers would kill that very quickly because it hadn't been invented by them and they'd find something wrong with it. So the alternative there was to find an interesting academic idea, find some service companies who could help that and just put some money in and run that as an arm's length organization, like a virtual company. And I got really interested in how do these things actually go from being some interesting ideas to actually turning into a business proposition and something of value. And I realized, whilst my background was science, it was very much about the people and making sure that you understood the people and how they interacted. So after my time in Japan, I was then approached by Biocity Group to start BioAscent, which was a company taking over some assets from a large pharma. I'll explain more about BioAscent later. And just in the summer there, I left BioAscent to go out and help a number of young companies. So I have a number of companies that I help at the moment, from an oncology discovery company to a stratified medicine organization and a stem cell business. I'm also helping out in some other projects just as a mentor and really just trying to help. One of the big issues is just people executing and different people bringing different skills to the table. Having gone out and talked to a lot of pharma companies, I was aware that there was a great need in the CNS, the neuroscience space, for interesting human cells to test their compounds on. So we realized that we could do this. We decided we could make human neuronal cells, not a problem. So it was very obvious to know who the customer was. That was pharma. And pharma have always got money if it's something valuable. So you tick the boxes and think, this is a great idea. Their problem obviously was they had lots of they had in vivo models, but how did they translate that into the clinic? So you think that this is worth a sizable amount of money, is definitely worth trying to create a business. So we set up stem cell services. We knew it was a good idea. We didn't need to ask anyone, we knew. We'd worked out, or my research team claimed they'd worked out how to make the product. And I knew who to sell it to. So it seems everything's going really well. We were aware that there were other companies that were trying to do this too, so we thought we should go as quickly as possible. So knowing all the above, we went for it. But of course, as these things go, the technical team were never quite happy with the product that they could make. There was another paper coming out. They were talking to more people and our potential customers. And the pharma customers are fussy. So they're always asking for what you haven't yet made. And so we had version 1, which then became version 2, version 3, version 4. And as it went on, I was told that we needed another year and more money to try and get this product to market. I needed to sell something. So we decided that we would go for it. We launched a beta product and the customers loved it. So we were really happy about this. They tested it, it worked really well. And then they came to me and said, okay, we've only focused on the technical and we got caught up in the technical questions and what it was they actually need technically for this thing, these cells to be able to do. Actually, operationally, suddenly they came around and said, well, we want this number of cells per month. I went back to my research team and they said, if we're really lucky, we might be able to make that in a year, but certainly no sooner than that. Pharma said, it's no good to us, so we won't buy. And that was it. So at that point, I realized technically we'd gone into a lot of detail. We knew a lot about this. We spent a lot of money and time on it, a lot of excitement, but we hadn't actually gone and really understood what the problem was for the customer. And what the problem was, they weren't really interested in the technical. They were interested in something that was slightly better than they had, but they needed lots of it because they were a big organization. So that was the first example of not really paying attention to what the pain actually was. And just as an aside, it was also an example of having a new idea and never being quite brave enough to launch it. And there is this execution problem, which you'll come back to again and again. And there's going out and talking to customers, there's always a danger that they will always ask you for the things that they would dream to have as opposed to reality. And there comes a point where you have to be brave enough to go up and say, this is my product and this is where we're at, and launch it. And so you can get caught up in what's called analysis paralysis, which is constantly wanting to gather more data and improve what you've got to the point that you never actually launch anything at all. And for the BioCity group, we were involved in, as I say, trying to create lots of startups. And almost 50% of those startup companies never actually launched anything. They created a business, it was registered in Companies House, they even got some investment. But they never quite got to the point that they were prepared to launch what they had. They were always trying to innovate, always trying to make it that bit better. And there comes a point you just have to stand up and go. So my second story, which again, the university thought this was a success. This is not a success for me. This was not a business. So I was approached by a university who had a professor who had created what he called a novel tunable polymer. Didn't sound tremendously exciting. However, by this point, I was interested in going and trying to talk to customers. So I discovered that this novel tunable polymer was actually incredibly valuable. Cosmetics companies are trying to make products all the time. They can charge enormous margins for the products that they sell with fantastic claims. Their biggest challenge is not the magic ingredient. Their biggest challenge is actually the carrier material that their magic ingredient goes into. And often they're tied to this carrier material having fixed properties because it comes from something natural like jellyfish collagen. So it has a fixed melting temperature, a fixed set of hardness properties. And often that doesn't really work to what they want to do when they make their magic cream. Having a tunable polymer means that you can actually make it to have a whatever melting temperature or whatever solidity properties that you might want. And this is something that doesn't actually exist. So again, technology breakthrough, clever technology. There is a demand. We know who the customer is, having talked to them. I'd gone out and done an initial study. I'll talk more about that in a few minutes. We knew that there was a problem, so it was quite a straightforward pitch. We've got a lot of people wanting to talk to us. Spin out, university tick the box. Sounds like a great spin out. So I say we thought it was a good idea. Again, told how to make the product to scale. This time I checked, and yes, we could make kilos of it, which is more than enough. So we planned on going, or this was my job, I was to go and talk to lots of cosmetics companies to understand what the pain really was. I thought, seems reasonable, learn from the last one, make sure that you've really got this clear before you go forward. So what was the customer pain? So having gone out and approached a number of cosmetics companies, one of them came back the very same day that I'd sent the email out and flew 3 people to meet us at the university that very week. Sounded really good. They were really quite flattered, and I thought, this is really going places. Yep. Was there a need to go and talk to other people? I thought, well, we'll wait until we've talked to this first company, see what they've got to say, and then we'll go and talk to others. So really, waste of time at the moment talking to others. We've got somebody who's really interested. They arrived. We gave them a pitch, which turned from being a pitch like you heard earlier to actually being a sales pitch. They're starting to asking technical questions. They put an offer on the table. They want to fund further development. They're going to co-market it. They're going to give some money for a postdoc and some research. Sounds great. But the next day, the university had signed with the company. And within 6 months, they killed it off. There was no ability for us to go and talk to anyone else because they had first rights to the IP. It prevented us from doing any further development on it. Yes, they paid for the research project and the postdocs, so it was technically a success. However, it turned out they had their own version of the technology, and that was what they were going to go with. They just didn't want anyone else to get access to it. And so, again, we hadn't taken the time to go and talk to our customers. And this is an example. My problem here was, yes, we'd reached out to some, but in your exercise in talking to people, you're not trying to sell to them. If you're trying to sell to them, it changes the dynamic of the conversation. And I'm being led down this path where they came to us, and we were probably intimidated by heavy-handed 3 execs coming flying up to do this. They knew very well what they were doing and played us really well. I guess at that point, we probably didn't know any better. Okay, so now I've learned a number of lessons here. We'll come to the third story. We're getting much nearer to current. And had I learned my lesson? Probably not. Bioscent. So Bioscent was a company that was set up. Merck, big American pharma company, had bought another US pharma company, Schering-Plough. As soon as Merck bought Schering-Plough, they shut all their European research sites within a year. All they wanted was the IP. So they left the research sites with all the equipment. So they were fantastic incubator centres. And a company called BioCity went and bought one of these sites based in between Glasgow and Edinburgh. And on this particular site was a unique facility. The rest of BioCity they're great at incubators, so they've got labs with equipment. This was a large set of freezers and robots. This is part of one of the stores and one of our big car plant type robots. And the function of this facility was to look after chemical collections. So in drug discovery, one of the starting points of drug discovery is testing large numbers of chemicals to look for some sort of change in a biological effect, and that's the drug starting point. And these chemicals are really valuable. Unfortunately, the biologists and the chemists don't care about the logistics of these chemicals. So it's really like the Royal Mail. Nobody actually cares how these things get to where they need to be, but everyone expects it to happen on time and perfectly. And that's where we were. We were really the Royal Mail or the mail service for these chemicals to be transported around the world. And Schering-Plough had put a large investment, £20 million worth of hardware into the Scotland site because there are no natural disasters in Scotland, and the collection was worth billions. We had massive capacity for storing 8 million compounds in 110 million storage tubes. And part of the business was just offering this as a storage and logistics to other companies. But there was a second part to the business, and that was that Merck had left behind the Schering-Plough chemical collection, which could be used by anyone involved in drug discovery. And so again, we thought there are a lot of companies out there. There's a lot of universities and biotechs who are looking for interesting chemical collections as starting points for drug discovery. So we thought we could address that market. Part of that unique technology that we had, the robots could specifically select compounds from this large set of compounds. So we could custom build collections. They could pick up to 4,000 compounds an hour. We could put them into any type of format, any concentration, and ship them anywhere in the world. And this seemed like a great business. So we can custom build chemical collections. There's a large audience, basically anyone involved in drug discovery or small molecule drug discovery. So they're everywhere. A lot of them have money. Chemicals aren't that easy to get. It must be quite a straightforward sale. Our compound set has come from a pharma company sharing ploughs, so you've got to think they're quite good starting points. So that covers one of the other big issues on quality. So we thought we'd go out and sell this. So lessons learned, go and speak to our customers. However, there's lots of other things going on at this time. Starting a business, hiring staff, all these other things. So we hired a really bright graduate and unfortunately made them create a questionnaire which we sent to the world. And we got lots of answers in the questionnaire. And so we'd gone and talked to our customers, so we knew what they were talking about, what their problems were. And what they really said was, you're absolutely right. It's a good collection. Yes, we want to customize. Yes, we want access to interesting compounds. Okay, confirmed everything we knew. Sales were dreadful. People didn't want to speak to us. And we thought that there was something that we're missing. And that was where I thought, well, actually, I've cut corners in this customer discovery process. And part of what BioCity were very good at was teaching something called the Lean Startup model. And Lean Startup is a big book, or big set of books. It's a really good course, and I would advise anyone who is interested in trying to start something to get into that. And part of it was customer discovery. And I'd been to some of the courses, so I assumed I knew customer discovery, but it's quite easy to simplify it based on the demands on your time. And so just before I go on and talk about BioAscent, I'd like just to talk a little bit about what customer discovery is. You may already know, but for me, I'd been to a number of courses and spent many days talking about customer discovery, and I hadn't really paid enough attention to what it actually meant. And so if I'm going to get anything across today, some of these points I think are very important to me, and they're the lessons that I teach companies and organizations or people looking to spin out. This is one of the critical things that I hammer home to them. So what is customer discovery? So these books, particularly the one on the right, Steve Blank, has made a very successful career. I think he's a Californian professor, selling books and worksheets and all sorts of things you can buy online. The book, I'll admit, there's some really interesting points, but it's quite a tough read. For today, I want to just talk about customer discovery, which boils down to this 4-point circle. However, reading something on this, learning more about it, I would highly recommend. Now, when I first went to the Lean Startup, they showed this cartoon. And I kind of switched off as I thought, well, actually, there's an awful lot to it, and I'm really busy, and yeah, I've got it. You need to find out, build some sort of hypothesis, strengthen your business model, and you'll be fine. And I thought we'd done that. We'd sent questionnaires out. We got back lots of data. We know what people want. We are in the game ourselves. We're all experienced drug discovery people, so what have we done wrong? And if that hadn't put me off, this certainly did when they said, well, here it is. There's only 19 easy steps. And I thought, well, 19 is probably 18 too many for me. So we'll just see if we can't simplify it somehow. And as you saw, I'd done the exercise, didn't make any difference to sales. So your business isn't going to last for long. So it was at that point I went back to that cartoon and focused in on just part of it. And it was here. How to fail less when making something new. I thought, well, that's exactly what I want to do. So what is it that I'm missing? So then you start working through and realize that there is actually a set of steps which, if done correctly, is well worth the time. So the first thing is, who on earth is your customer? And I think that's a really tough question for a startup. I mean, you've found people who have taken on, but you're talking of trains and buses, there's lots of different people who could be your customer. And who within that is your actual customer? It's not the bus driver. Is it procurement? Is it Is it the council? So you've got to think, who's your customer? And so the first thing is going and talking to a range of people. And I don't mean questionnaires, emails, I think are a waste of time. You need to go and actually talk to people, whether it's by phone or face-to-face. What you need to do is figure who your customer is. So you're maybe not going to know that at the start. So you may have different pools of people that you think are customer types. And then you look for, who do I know, or how can I get access to some of them? What do you think the problem actually is? What do you think the problem is that you're trying to solve? You don't know what they think the problem is yet, or even if they do know what the problem is, what do you think it is? And how are they going to find you? And how are you going to get that problem out to them? And then you create that. That is your hypothesis. I'm trained as a scientist, so I like data. So you create this starting point to gather data. So just to get our bearings in the lean startup, we're at this stage, which is customer discovery. Finding your problem, getting some sort of product back out to the customer as quickly as possible, and finding out how it works. I'm not a big fan of the word pivot because everyone uses it, but what I think it means is when you find that what you've got is interesting, but it's not being pitched quite right, or it isn't quite right, subtly changing it and testing it again until you get it to a point where you have a customer set that will buy from you, and from there you can expand. So the process, this 4-point wheel, you've got your hypothesis. What is it you think your business actually is? You find a set of people to talk to, and it might only be a small set of people, but I guess you use everything you've got to find a small set of people to start with, preferably from a few different customer groups. You scope out who you think your customer group looks like, and then you put them into sections and you go and gather data. You go and talk to them. You're not selling to them, you're asking them about this particular area, this particular problem. What is their problem? Get them to tell you. You're not telling them. Only once you've heard their thoughts can you actually tell them a bit about what you're doing, because if you do it too early, they think it's a sales process. Most people think you're there to sell, and in this, as I hope showed you in one of the previous, you're not there to sell. Well, maybe not this time. You may well go back to them to sell, but today you're not selling. So then you you explain some of what your product, your service, your offering, your idea is, and you get comments, criticism or comments. You take that information, you then figure whether what you've got is right or whether you need to rethink it. Also, is that group of people you've talked to, are they your customer? One of the things that I think we all find really tough, you can spend quite a bit of time building up what you think your business is. And it's going to be clever. You've thought of it. It could be really special. So there is the odd person who will rip you to shreds just because they like to, but most people will actually, you're trained not to upset other people, call the baby ugly. And that's a really tough one. If somebody's not going to give you some honest feedback, this is what you need. What you need to do, you need to take the criticism and the comments and try not to take it personally. It's easier said than done, but it is a really important thing, because if you don't, you end up hearing what you want to hear, which is where we were with BioAscent. And you hammer it home. The initial goal is learning, it's not sailing. And I'll hammer this one home too. You have to be able to take the criticism. You have to be brave enough to go out there and put yourself on the line and talk through what you think what your product is or your service is and how it might solve a problem. And if they come back and you get a lot of negative, it isn't killing your project. You can go back, figure out how to re-engineer it and go back out. It may well be one day that you do realize that you actually don't have a market, don't have a customer. But you have to go through this process. And if you don't, I think you're risking failure at a later stage. So the Steve blank thing, being Californian, he likes his words. Get out the building. Mentors all seem to like shouting that at a certain point in the lean startup process. What they mean is go and talk to people. Go and ask them. And you're not just asking specific questions, you're also watching emotionally how they respond to these questions. What is it that they're trying to do? What's the difficulty and how do they get around it? What sort of workaround have they got to a particular problem? And by asking, there's a saying you can say why 5 times. I've never been brave enough to keep saying why 5 times when asking a question. But certainly asking a few times, you can really start to tease out particular issues that the person has. So how do they currently deal with it? How big an issue is it for them? If it's not a big issue, they may not be prepared to spend money. But if it is a real challenge, it wastes time, wastes money, or doesn't work properly, that's where you can really get in there. So what is it? How much would they give to remove the pain that they have? That's what you're trying to get down to. And also, like all good business development, at the end of it, once you've got in front of somebody, ask them at the end, who else can they introduce you to? Chances are, if you're in front of them, they'll kind of feel obliged to give you at least one contact. So use that opportunity to expand your network and also to find more of that customer type. And just don't try to sell. It completely wastes the opportunity. People probably feel done, particularly if you've explained to them up front that this isn't a selling, you're just trying to gather some data. Don't ask for opinions. Opinions are rubbish. Everyone will give you opinions all day. If you put people in a focus group, they'll throw opinions out. Doesn't mean that they'll ever actually buy. Doesn't mean that it's a problem for them, but they'll give you their opinion for sure. Ask them specific questions about their pains. Don't use email or questionnaires. An email is a good starting point, but do not try and gather information from email alone. And don't be afraid to ask clarification. One of the things I've discovered, people love to talk. So if you can get them to talk about what they think their problem is, generally they'll talk for much longer than you've got to listen. And you can find out enormous amounts of valuable information, so make the most of it. Don't be afraid to keep asking for more information. And it's this you discover that on the surface, people are not very good at knowing what it is they actually want. And this is why you have to use the process of trying to understand what their problems are and then focusing in on these to understand what their pains are, because they may not be able to articulate these, as I said at the start. Telling stories, get them to tell stories. Stories are a great thing because they'll reveal much more than they mean to once they're into a story. Stories about the problem, what they did or what they're currently doing, how many people does it take, and also emotions. Emotions are much harder to hide. So look at how excited they get, look at how angry they get, record this information because this is gold for you trying to figure how to pitch your product back to them. And make sure you talk to as many people as you can. One of the other things is you can find one person who thinks that your idea is stunningly good, like we did, and you go after it, and then you discover there only is one of them. You're looking for a market that is scalable and repeatable, that you can then go and grow and grow. So that's the process. Back to BioScent. We knew that we had a chemical collection that should be interesting. We knew that lots of people are looking for chemical collections. We just can't sell it to them. We know that no one else offers the type of customization that we're offering, or the time, or the format. We know our customer type is massive. We know they've got money. So we thought we knew what the customer problem was. So why are the sales so poor? And there's very little engagement from our customers. They just don't want to speak to us. So I went back and did customer discovery again and ended up speaking to over 100 people. And the reason there was so many was because I wasn't sure who our customer actually was. Was it the chemist? Was it the biologist? Was it procurement? Was it project management? Senior management? Who's the one that's actually making the decision? So I went and I talked to them all. And what it came down to was biologists versus chemists. Having told this story in chemistry-heavy environments, this can be quite a tough one to tell. But what I discovered is biologists and chemists come at this problem for a very different angle. It's the biologist's baby. The biologist has found something interesting, has spent a few years working on it, whether they are in industry or academia. They have discovered some interesting protein that changes. They've validated this in some human or animal model. They've found some compounds from somewhere. They've done some testing. It's at this point they show it to the chemist. And in 40% of the cases that we talked, whether it was academia and industry, and this shocked me because it didn't make any difference, in 40% of cases the chemist would come and look at the chemical that had been found to change the biological effect and say it's rubbish. It's toxic, I can't do anything with it, it'll never make a drug. Project was killed. And in certain institutions and companies, this created this phenomenon where the biologists would hide their results from the chemist for as long as possible in the hope that because it had gone so far down the track, the chemist couldn't say no. And the chemist would hide from it because they were seen as project killers. So they were seen as hated people. And so there was this tension, and this is where the emotion came in. So we've been selling, we've got fantastic software, we've got these big robots, and we can do all this wonderful stuff. No one actually cared about that at all. That wasn't what they were interested in. On the surface it was, we want compounds and we want to get them quick and customized. Deep down it was about an interaction between biologists and chemists. Trying to tell that to my board members and particularly my own company, who were all drug discovery people, was tough. What it boiled down to was chemists want to be loved. And if you get that chemists want to be seen as super people. So they've got years of experience. They know how to make a drug, or every chemist comes at it from a different angle, but they all know what they want to do. They want the opportunity to shine and be superstars. And what was happening was they were being offered a project which had already failed in their eyes, even though 2, 3, 4 years had been put into it. So the question was not, do you want our compounds? The question was, how do I make a chemist a superstar? How do I make them loved? And as I say, that was a tough sell to my own organisation, my shareholders. However, it was all about giving chemists control. And so we completely changed the way that we pitched our service. We changed it to give chemists control. I noticed that in the car industry, car companies suck you in by pretending you have control over how your new car is going to look by changing it online, by changing the colour and the wheels and whatever goes inside. It doesn't make any difference to them, but to you, you feel you have control over this. We did that with chemistry. We created a website that had a toy, or we called it a tool, that allowed them to play around. And so the chemist felt that they were putting their own shape, their own knowledge into the chemistry set that was being made. So then they weren't being involved much earlier in the process. The biologists would use the chemistry set that the chemists had picked lovingly. That way, when something came out of the project, the chemists already knew that they could do something with it. And this changed. Building this website and pitching it in a different way to the chemists, that they could take control over these projects and be seen as the good people, as what they were, bringing their expertise and experience. Doing that made us go from no sales to a really healthy company in a short period of time. And so to sum up, get out the building. Be brave and talk to people. Find out what is their pain. Not just what they tell you they want, because they may well be asking for the impossible, but within what you're doing, find people who actually have a need for what you have, and who specifically within that organisation should you be talking to, And then get down to just how big a pain is it. The bigger the pain, the more money you can charge at the end of the day, and that's an important point too. Keep asking why. Suck them dry of information. People love to talk. Not everyone. Be brave enough. Be brave enough to also talk about your idea, even if they're going to chop it to bits. You'll gather hopefully some useful information. Be strong. But it's what is it worth? And remove the pain. If you can figure those things out, you can have a product, you can have a company, whatever it happens to be, and it works for services, it works for products, it works for partnerships and collaborations as well. If you can understand where the other person's coming from and what their pain is, you're in a much better position to pitch and be successful. And that really was the lesson I was hoping to get across to you. Those are my experiences. So I'm happy to take questions, or if anyone has any, then I'm happy to get emailed. Thank you very much. Finding those contacts, I think, is a key part, and that's where, if you don't have those contacts yourself, and it can be tough, I think that's where mentors or contacts, and you pull in every favour you can from anywhere, whether it is lectures. I don't know if you're on LinkedIn, that's a very powerful tool to me too, and generally people will respond to an approach, and that's where the not sales is an important part of that. People will be incredibly helpful and give half an hour of their time to take a call. And if not, pitching it in a way that offers that what you're trying to do is just gather some data. And if not them, could they suggest somebody else? I've discovered as well, often people feel almost obliged to give you some other contacts. So yes, it can be tough. And that's why I think you have to look and say, it's hard work, this. And I'm not saying, unfortunately, there is no simple, quick way. The questionnaire, the looking online, you can gather a lot of background information on size of the market and types of customers. But in reality, if you don't go and actually speak to these people, meetings, conferences, anything you can get access to, and you have to be brave and go up and stand there and break into conversations. And it's not for everyone, which is why I get asked to do that for people. But I think what I say to them is, there's no getting out of it. If it's your business, you need to do it too. Because it's all very well me doing it, but if it's not specifically my business, sometimes I may miss some of those emotional triggers that I may not understand because I'm not embedded in it. Whereas somebody, if it's their baby or it's your baby, you've got a lot of understanding of bits and pieces, and if somebody says some trigger word, that allows you to mine into that with the why, or what do you mean by that, which can be missed. So it's easy to hand this off to somebody else. But getting back to, there's no easy answer to that. I think you use everything you've got, from any contacts, from university staff to LinkedIn, to anybody else that you can think of that might have access to one of the people you want to talk to. But once you get started, if you're half lucky, you can start a chain reaction that will then allow you to expand that particular segment. I think, again, it can be a tough question because it depends on the type of organisation and the structure. From a big organisation that's very fixed to a small organisation that's very fluid, and it depends who you're trying to target. So university has large fixed generally. So you'll be able to see different types of people like procurement, and you'll be able to see also whether it's the people actually doing the work, or their project manager, or who's managing them. And again, everyone has a role within the purchase decision, bigger or smaller. And the only way you can actually find out is to target a number of universities. and ask that question at a number of different levels. Pitch that to the person that's actually doing the work, pitch that to the group leader, and pitch that to procurement. I mean, and back to questionnaires are easy, and you probably will get a lot of response. I think we got 90 or 100 questionnaires back, which to me was great for data. But actually, it didn't allow me to mine into what they meant sometimes, and so it allowed us on the surface to feel we understood what the problems were, but actually we didn't. And yet, procurement is back to the same thing. It is just who's the person that's making the decision, obviously, but then how big a influence does each of those people have? And you need to go to more than one. It's not just one university. You need to go to multiple universities to start to look for patterns, so then you can scale this up and then assume that it potentially would work over multiple sites. Yeah. So do you pick on users, customers? There's the best answer is, of course, you would do both. The pragmatic answer is that there's never enough time to do everything. And the danger is often that it's very easy to find one particular type of person that will talk to you, but you do need to find multiple types. What I've learned is that it's always valuable to talk to as many different operators within the process as possible. Even if you only talk to two and then realize that actually you've kind of got the information that you can get from them, and they maybe don't have a role to play. But you don't know that until you've talked to them. You can assume, and your assumptions can kill you sometimes. So maybe in that example, does the bus driver have any role or not? You don't know. It may well be that absolutely they are the primary person who's responsible for reporting it. So you may be solving a big pain for them, and that they may be able to be the person that then pushes that up the chain to say, I need this now. Or it may be that it's a company-wide or a council-wide. I think you cannot assume without having done a little bit of work. But it may be very quickly you discover that there is no value to talking to more of that type of person, and so you just park them. But you don't know until you've tried it.
But thank you very much indeed, Simon, for all that